Hello everybody, this is my second video, which is basically a remake from the original second video, which I decided to delete and redo it because it ended up being too long, and plus when I uploaded my first video, which was 15 minutes, it took almost forever, so I changed the settings a little bit and decided to redo this video because it's my healthcare problems that I have had for 4 years. And I'm going to try to keep it around each video around 30 minutes. And the old one ended up being almost an hour. And I decided that's too long, and I figure shorter video upload time is quicker, plus I lowered the resolution down a bit to make it where it's not such a big file. So here it is, my healthcare problems. It started in February of 2021, where I ended up having pneumonia. I was walking to work around a mile each way, and I started getting real winded walking, and plus at one point my chest was kind of hurting, and I mentioned it to my brother, which we lived together, and he suggested going to the emergency room to get checked out. And so went to the emergency room, and they mentioned that I had pneumonia. So they ended up put a tube on my side going into my lungs to drain my lungs out. Drain my left lung out. And guess what side I sleep on? I sleep on my left side. At that time I did. I gotten used to sleeping on both sides now. But at that time I could only sleep on my left side. Which means the first night I didn't get no sleep. I finally got some sleep the second night due to some medication. I was able to get some sleeping pills I was able to get. And so, but I had the chest tube in my side maybe around 3 days or so. And so I ended up being in the hospital, I think around a week or so. And of course, every day they came in to get an x-ray just to see how my lungs was doing. I did get out of the hospital then, about a week later, roughly. And then my primary doctor scheduled me for a follow-up. And so on the follow-up appointment, he was looking over my x-rays, and he noticed a lump on my left shoulder. And so he said, better get it biopsied. which, in essence, I think it was the Lord allowing pneumonia to happen because the doctor was able to see the lump early. So I got pretty quick, got treated fairly quickly. But anyways, after they did the biopsy, maybe a week later, or I can't remember exactly, but then I got, I, then after the results came in from the biopsy, it was found that I had lymphoma, which is a form of cancer dealing with the lymph nodes. And so they scheduled me for basically 6 rounds of chemotherapy with a PET scan after the third chemotherapy. And it was every 3 weeks that I had to have chemotherapy. And it was always on a Wednesday because that's when the doctor was in. I would have rather had it on Friday because then I had the whole weekend to recover. But with it being on a Wednesday, and my work schedule was Tuesday, Wednesday, Thursday, and Friday. So the weeks, every 3 weeks it was, I work Tuesday, then I miss Wednesday due to the appointment, and Thursday and Friday woke up feeling nauseous and that, not really feeling good, and tired. And so, I mean, it's a hard thing to deal with, you know. Going through chemo, it affects people all different ways. But after the PET scan, after 3 chemotherapies, it was found that I was cancer free. But I still had to finish the chemotherapy, which ended, last one was around first part of September of that year. And then for 5 months things was good, no problems at all. But February of the next year, I was having health problems again, where I went into the emergency room and found out the lymphoma came back 5 months later. And of course, during the summer of the previous year, the owner of the apartment complex that I lived in, he said that his wife had lymphoma, and she went through a procedure called CAR T-cell therapy, and it worked for her real good. She hasn't had relapse or nothing on it. So knowing that, when I caught lymphoma the second time, right away I thought to do that procedure, which what it does lower your immune system. And what it is that they take some white blood cells from you, that send it into place in California where they re-engineer it to fight cancer cells. But because of it lowering your immune system, you had to stay home for 1 month other than doctor's appointments. And you had to have someone with you at all times, which in my case was my brother because we lived together, and we was thinking of asking someone else, but then he decided that he'll talk to work, see if he can get leave of absence for that time, which they ended up giving him leave. He didn't get paid for it, but he was able to get leave for that time, so he was able to drive me to my appointments and everything. But, I mean, after that, but still that I had to have, they did a lot of tests before I got my cells back, before they even took the cells. One thing I had to do is get a tooth out, because anything that could cause any infection could be dangerous when you do the CAR T-cell therapy, because your immune system was so low at the time. But they also told me that the side effects, which I'll get into certain side effects at a later video. I like to do a video talking about different treatment options available for lymphoma, and even explain on the different types of lymphoma, which I ain't gonna do it now because it will make it real long. But anyways, so I finally, they went to take my cells, and the nurse said she almost didn't finish it because of she said I wasn't really looking that good at all, and she decided to admit me into the hospital. They did finish the procedure, but she admitted me into the hospital, and me and my brother already had a bag packed for me for if I had to stay at the hospital, because that was one recommendation that the cancer doctor said to do. So my brother went down, got my bag out of the trunk, and I can't remember how long I stayed. Few days. But anyways, got back home, and I think at the time they also did some radiation. I remember I think they did a chemotherapy treatment in the hospital, and where one lump was right around this general area, maybe on the left, this general area. And I remember after that night, after having the chemotherapy treatment, I ended up waking up with my heart racing. It was like around 150 beats a minute, which is kind of dangerously fast. And of course, they had oxygen monitor, and they was monitoring my conditions where they can see it at the front desk. So it wasn't no time that they was in the room, and they said that they're going to stop my heart for a few seconds, which required a syringe, a shot in the arm, and it stops your heart for a few seconds. And that was kind of a weird feeling because, I mean, my natural thinking is stopping the heart. You know, it could, I mean, it could end up passing away from it, but that wasn't even close to happening. So, but anyways, started when the heart started beating again. It was back down to normal, and so finally, the got back home, and I think there was several other appointments I had to do before I had got my cells back, and then I got word that my cell that my cells had came back, and that I was ready to get them. But before they gave me my cells, I had to do 3 days in a row of chemotherapy, and then you get your cells back. And of course, at that time, during that period, I wasn't working that much. And of course, when I got my cells back, I could not work. But I mean, my employer and that, she was cool with it. She knew what was going on because they kept her in the mix. So everything was cool as far as that goes. And we was able to always make rent and everything because around that time I think was it was around the COVID period that somehow we ended up being able to have enough money in the bank to be able to cover for like 2 months. So we was okay on that regard. So finally got my cells back, and one of the like side effects was like could be high temperature, also could be hallucinations and a lot of different things. But I did not have any bad side effects at all. And I know that was the Lord watching over me. And so a little bit over a month went by. Wasn't much over a month, but so, and keep in mind, we went over to take care of Dad, mainly my brother, when I was going through that procedure. Saturdays used to be always doing his laundry and maybe cleaning what needed to be cleaned and just doing certain things for him. But when I was going through that procedure where I couldn't really leave the house, my brother was always going to Dad's around the time that I take a nap. And with laundry, he always picked up his laundry. I think on Friday, and brought it home with him and did it at our place. And then he went drop it off on Saturday, but he wasn't ever gone really that long. But the then the little over a month went by, and where my dad ended up pressing his health alert button that he had because he lived in a retirement center which has health care type thing as a third party during the day, but during the evening there wasn't no one. So that's why everybody there had alert problem that contacted the ambulance and that. So my brother ended up getting a call saying my dad was headed to the emergency room. And this was early, maybe 4:30, 5 o'clock, somewhere around that in the morning. So I remember us both going to the hospital to see what was up, because my brother took care of his healthcare needs and that. He was the one responsible for that, could sign different documents my dad had and everything, power of attorney. So that's why he always had to go. And being that I went, it had to been over a month after getting my cells back. So of course, first thing they always check when you go to the emergency room, don't matter which hospital you go to, they'll always check if you have COVID. And which my dad ended up having COVID, tested positive. And plus, he did not have his teeth or his hearing aids because he was real hard of hearing. So it was almost like the doctors couldn't really talk to him at all. So because of that situation, my brother, when we got word of him having COVID, I instantly kind of walked out of the room, outside the door of the room he was in, because I knew it would have been dangerous for me to be close by. So my brother mentioned about going to his place, picking up his hearing aid and that, and asked if he should just drop it off at the front desk. And they said yeah. So we left. He took me home first, and then he went and did what he had to do at my dad's place. And while he was gone doing that, I said that I might as well take my temperature. I didn't feel hot or anything, but I said might as well take my temperature. And I had a high temperature. It was high enough where I thought it's best to go to the emergency room to get checked out. And so I called my brother, told him the situation. So when he got back, I met him out in the parking lot and we went to the emergency room. And of course, they tested me for COVID, and I ended up having COVID. And of course, they admitted me and in the hospital. And when I got settled in the hospital that day, my brother said he's going to he's going to go get tested also. And at that time, they was doing the free tests, had a regular center set up where they did the test right from your car. I think that's how he did it. But anyways, he got tested that day. And of course, he ended up getting the information back the next day, I believe, that he had COVID. But of course, he was healthy enough where it wasn't danger for him at all. But for me, it was because of the low immune system. But anyways, they did their regular procedures on me that they do for COVID. I do an IV and that, and ended up, I think they also did, no, not right then. I was there maybe about a week. Then I was able to go back home. And then around a week later was having, I think it was like breathing problems that I was having or something was going on that I ended up going back to the emergency room to get checked out again. And I think it was high temperature that I had. And ended up, they admitted me again, and that time I ended up being in the hospital for 2 months. And with major breathing problems. I remember it. They had me on normal oxygen at first. When they first found out I was in need of oxygen, it was pretty much at level 4. And then it went to 5. Then 6. And that was the highest that they could actually go. It went up to 8, but regular room oxygen, they usually didn't go that high on it. But they ended up bringing in a machine called high flow machine, which is a nasal cannula, but it also had moisture that would be drawn in because oxygen does dry out your nose, so they added moisture to the mix. And that, that in like maybe day's time or a couple days, they ended up having it up to 90%, and that pretty much maxed out on that machine, and that wasn't even enough. And at nighttime they had me on the bypass machine, which is a actual mask that fits over your mouth and nose, and with no air can escape out the sides or anything. But because if it did, it would ring an alarm saying something's wrong. But which is more safety, I think, because with it ringing the alarm tells you someone took the mask off or whatever. And of course, being my situation, why would I take a mask off? But anyways, I remember a couple of two two of the night times when I was sleeping, I woke up with, and one tube came out of the mask. I was I was able to get it to hold it in place till the nurses came, and they was able to get the situation taken care of, put the tube back in, and everything was fine. But the second time the tube came out, it went down off the side and I couldn't see it. And my oxygen level shot down pretty quickly. But it didn't take any time for them to come in to take care of it. But then they got down to where the high flow machine wasn't enough, and they mentioned about getting a tube in me. And I'm sorry, I've got to leave it here because it's over 30 minutes. So this is part 1. Part 2 will be coming up within a day or so. Until then, talk to you later.